So welcome everyone. Today we have a talk today about stress management techniques for medical professionals. This webinar is in collaboration with our partners from BetterHelp. And so this week AMSA has been focusing on physician suicide awareness and prevention. So today we thought we would take some time to focus on the prevention aspect. We wanted to discuss what burnout is, how we can identify it, what are some signs of depression, how we can focus on this early on in our careers, and what strategies we can use to help manage those stresses that we face on a day-to-day basis. So I want to begin by introducing ourselves. My name is Ramni Kunjan. I'm on the AMSA National Leadership Team. I sit on the Professional Development Committee, and I am the Education Development Coordinator. And I'm also a second-year medical student, about to enter my third year, along with Maeve Hesu, and I'll let her introduce herself.
I am a licensed marriage and family therapist based in California. I'm currently the committee and clinical support manager at BetterHelp, which is an online counseling company that you're going to hear more about in just a second.
So what is BetterHelp? They are an online professional counseling platform that's accessible through almost any platform, whether it's a tablet, phone, laptop. It is very affordable. In addition to being AMSA members, you guys also get a further discount, which we'll discuss at the end of this presentation. They offer licensed therapists in many different fields, whether it's for marriage and family, social work, mental health counselors. So if you do want to find out some more information, you can visit their website at betterhelp.com.
So today, as Ramnik mentioned already, we're going to be talking about what burnout is, identifying it, preventative measures, and some ways to manage stress. All right, so healthcare provider burnout. Why are we doing this? Why are you guys having an awareness week about this? Being a healthcare professional and being in the helping profession comes with a lot of responsibility, a lot of expectation, and a lot of mental and emotional output that goes into the work that you do. I am a therapist, so I have worked with many individuals, including healthcare professionals, physicians, nurses, doctors, dentists even, and these are some of the common themes that I have seen in my practice working with individuals from your field. Exhaustion is a big one, so just being tired all the time. Existential crises, the questions coming of, did I choose the right career path? Am I doing the right thing? Am I living the life that I should be? You may have already experienced some of these thoughts and feelings as a medical student. Guilt is a big thing in the healthcare community. Why? Because sometimes your patients get sicker. Sometimes your patients die under your care. And so there's a lot of guilt associated with the treatment that you provided and really racking your brain for something that you could have done differently. Grief comes with some of the times when you lose patients. A lot of grief just comes from the loss of anything. So this is a common experience for physicians, doctors. So it's something that is important for you to know that may or may not happen to you. Anxiety, depression, we see this a lot as well, and countertransference. For those of you that have not heard of countertransference, this is a concept that you hear about a lot in the world of therapy. But ultimately, you are a human, your patient is a human, so this connection that you're making and developing over time is a human relationship. So all the thoughts, the feelings, the internal experiences you have about and towards your patient, that is what we might call countertransference. So if you do not address some of the issues that may come early on with burnout, this can lead to even bigger consequences, right? So I do want to touch on some information that's really important for you to be aware of and to know. The suicide rate amongst physicians is one of the highest of any profession. Okay, so at least one doctor dies by suicide in the US every day. This is often a result of untreated or undertreated depression. This is not just exclusive to North America. Finland, Norway, Australia, Singapore, China, and elsewhere have shown this increase in anxiety, depression, mental and emotional challenges, and suicidal thoughts amongst medical students and healthcare professionals. So I wasn't talking about those things to freak anybody out or scare people from going into this type of work. But if you don't know that this is the reality, then it's going to be really hard to try to address some of the concerns that may come up for you as medical students and doctors in training. So some of these other common concerns I've seen from physicians and medical students specifically is having this lack of a work-life balance, burnout, as we've been talking about, the high demands and expectations that come with your role as a physician, the competitive nature of your field. So this starts in undergrad. You guys know what this is and you're aware of it. And it sometimes even makes it difficult to focus on patient care because you're maybe very concerned about your performance as a doctor, your track record, lack of or too much litigation, being sued, all that kind of stuff. So competitive nature of this field can be very stressful for a lot of reasons. Long shifts, this is very well known in the medical profession, having these extended periods of time where you're expected to be focused, attentive, and on it. You're already experiencing this as medical students, right? These long periods of time that you need to be extremely focused. And this can sometimes lead to a lack of sleep. And whether that's because you have no time to sleep, or because even when you do try to get to sleep, you have so many things going on in your mind and in your body that make it difficult to fall asleep and or stay asleep. And more recently, I've been hearing concerns about decreased resources and residency positions. This is something I imagine you're thinking about as a med student. Once you're done with school, it's going to be time to match. You got to find your internships, your residency positions. And apparently, as more time goes on, as more people enter the medical profession, there aren't as many residency positions or places that can train and place you. So what can we do early on? What can we do before we're doctors? What can we do to identify, to prevent, to help, all these kinds of things? We can start with defining what burnout is, just so you know what's going on with yourself. For those of you that have not heard this term burnout, it's otherwise known or experienced as chronic stress. Chronic meaning longevity, right? It's been around for a while. There's physical and emotional exhaustion. It's symptoms that don't go away. The exhaustion doesn't go away just because you get a good night's sleep here and there. You're just always tired. Cynicism and detachment. You might know this phrase as being called jaded, right? A lot of older professions, or a lot of older people, in a lot of professions may be described as being jaded because they seem like they no longer enjoy what they're doing. Maybe they have an increased sensation of pessimism. Maybe they kind of communicate that they are detached from the things that come about as being a doctor. Maybe they're isolating themselves more. And feelings of ineffectiveness and a lack of accomplishment. So what do I mean by that? Maybe there's an increased feeling of apathy, hopelessness, not really knowing whether they care about doing this anymore. Maybe there's increased irritability and lack of productivity and poor performance in the workplace, which for doctors, which for physicians can be very, very detrimental, not just for their professional track, but for their patients. So it's really important to be aware now that a lot of these things are common concerns in your profession. Why do I say common? Because I want you to remember and understand that you are not alone in this struggle. A lot of people that feel very alone, isolated, on the solo with this kind of stuff tend not to reach out for support when they need it. Other things that you can be mindful of or looking for are chronic fatigue, like I mentioned, just constantly tired, always lethargic. Maybe you're experiencing insomnia, which is this difficulty with sleep, whether that's you have a hard time falling asleep or you have a hard time staying asleep. So sleep is necessary. And if you're not getting it, then you're going to get really tired. And that's just going to make a lot of your stressors and issues and problems, challenges, they're going to be worse if you're not sleeping. Other things that you might notice is an increased forgetfulness. Why? There's a whole bunch of reasons for that, but cognitive function is going to go down when you're extremely tired or when you're experiencing burnout. Some other physical symptoms that you can be on the lookout for: chest pain, heart palpitations, shortness of breath, tummy aches, which is, gastrointestinal pain, dizziness, fainting, headaches. as medical professionals, you guys are aware that it's important to rule out any kind of organic disease or medical cause for some of these symptoms. But if you find that there is no medical reason to experience some of this stuff, then chances are you're experiencing psychosomatic symptoms, meaning the stress and burden of emotional and mental hardship is causing your body to kind of freak out and start doing all these things to alert you that something is wrong. You probably already know as well in your studies that a lot of stress is going to compromise your immune system. So you may notice yourself getting more sick more often. You might also experience a loss of appetite. So if you're not eating well and nourishing your body, then you're going to get even more exhausted. So it's really important to feed yourself well, feed yourself healthy things. So if you notice this loss of appetite that you don't want to eat anymore, then you probably want to check in with yourself to see what's going on. Other things to notice: increases in anxiety, depression, and anger are good signs that something is going on with you and you probably want to intervene at some point. So now we're going to shift gears a little bit and talk about some techniques, strategies, and ways that you can manage this stress if you're already there. Okay, so as medical students, you guys are going to experience a set of unique issues and concerns, but you're also going to experience problems, issues, challenges that are universal to people, and universal especially to healthcare professionals. So kind of diving into some ways that we can deal with stress. The first and biggest thing that I want to talk about is self-care. As it describes in the name, it's about taking care of yourself. So for those of you that have been in an airplane, you know the spiel that they give, the safety spiel before you take off. They want to make sure you know how to buckle your seatbelt. They want to make sure that you know where the emergency exits are. And they also talk about instructions on what to do if the oxygen level changes in the cabin. If that happens, then this oxygen mask is going to fall out from the ceiling above you. And they're very, very clear to instruct you that if you are with someone that may require assistance with this, you need to put your mask on first before then trying to help this other person. Why? Because in that time that you're trying to mess around with the mask and get it onto this other person, both of you are now losing oxygen and your ability to function is being compromised and impaired. So they want to make sure that you get the mask on first so that you're fully ready, present, aware, alert to help this other person. So why do I bring up this analogy? For you, you want to make sure that you're taking care of yourself, because if you are struggling, if you are feeling like you're drowning in stress and you're not able to be fully present for your patient, then both of you are going to suffer for that. So it's really important to take care of yourself. And there's a whole lot of good ways to do that, which we'll be talking about throughout this. So one of the things that you can do is some preventative activities, preventative ways to deal with stress. So a big thing is you want to make sure you're still socializing and connecting with other people. Otherwise, it becomes a lot easier to kind of suffer with your challenges and your struggles by yourself, and you really don't need to. So make sure you're still making time for friends or family. Another big thing is to remind yourself often of what you value and what you're doing. At some point in your lives, you made the decision that you're going to take on this long and difficult and challenging journey to become a physician, to become a doctor. Why? Think of that reason why, or the many reasons why, and remind yourself of those things, because it's really easy to lose sight of what you wanted to do when things become so stressful. So remind yourself of the bottom line. Why do you want to be a doctor? And keep that near and dear to your heart. I also think it's important to mention that it's good to find meaning and satisfaction in all areas, in other areas of your life, not just in your professional track. Being a doctor is great, but it doesn't have to be your entire identity, because then when things get stressful or things go wrong, it gets really hard to stay in tune with a strong sense of self. So find meaning, satisfaction in other areas of your life as well. A big one is time management. I imagine most, if not all of you, are already pretty good at this. Otherwise, how would you have gotten into med school? But you want to maintain something like this and keep it going to set yourself up for success. So setting healthy boundaries with people, with school, with tasks, all the things and expectations of you. You want to make sure you're protecting yourself and your time. You want to set aside designated time for breaks and to relax, to let yourself recover, rejuvenate. And you also want to think about good sleep hygiene, because if you're not sleeping well, like I said, you're just going to get more tired, and being more tired exacerbates mental and emotional struggles and challenges. So good sleep hygiene is something that I imagine a lot of you have heard of. There's a ton of information about that online, but really briefly, you know what, you want to set yourself up for a good night's rest. So if you have a lot of bright fluorescent lights in your room, if you have the TV blaring, or if you're constantly looking at your phone right before trying to shut your eyes, it's going to be pretty difficult to get a good night's rest. So think about and look into good sleep hygiene. So these are all good habits, but you want to identify the habits that work best for you and establish them as habits. I read somewhere that it takes 21 days to really develop a habit. I don't know how accurate that is, but if you find that something is going to be helpful for you, you got to stick with it until it turns into a good habit that's going to be helpful. You also want to have good outlets to de-stress. So each of you is going to have your own individual and beautiful way to de-stress, right? You're going to have hobbies, things that you like to do that aren't practice medicine, but other things that you can be incorporating, and I hope that you will, are exercise. So getting some kind of movement into your body. As healthcare professionals, you know the importance of getting your heart rate up, of breaking a sweat here and there. So make sure you're incorporating exercise when you can. You also want to be eating well, so whole nutritious foods. I'm not talking about treating yourself with snacks all the time. I'm talking about nourishing your body and giving it what it needs to thrive. You also want to sleep well, which I've talked about already. And of course, you want to make sure you have social supports in place. So whether that's friends, whether that's family, you want to have other people that you can connect with and get support from. So importance of social connection comes up for this next slide here. It's really important for you that you can reach out for help, because if you don't, what happens? People that tend to isolate themselves have increased symptoms of detachment and those feelings of hopelessness. So kind of just losing sight of the interconnectedness of humanity can lead to a pretty dark place and can result in reckless behaviors. So basically, I'm not trying to freak you out here, but I think it's really important to remind yourself that you want to make sure you have social supports in place and that you don't become a loner out there with no one to turn to. Another interesting fact here is that depression and substance abuse is increasing in healthcare professionals. I imagine substance abuse is something that is becoming more of an issue because a lot of professionals are trying to self-medicate initially, or maybe it's in a form of escape or whatever it is, but it is increasing. And both of these things are occupational hazards. I imagine you can understand why, but really briefly, if you are being affected, if your ability to practice medicine, your ability to focus and have attention and care for your patient is impaired because of a mood disorder or because you're on something, then it's going to turn into a really ugly situation for you and your patients. So I saw this survey recently. 90% of physicians in this survey have reported that they've expressed feeling depressed at some point in relation to the context of the professional field of being a physician. And in that same survey, only 33% indicated that they have pursued any kind of professional intervention. So that might be therapy, counseling, talking to another doctor, anything like that. So what I have noticed in my practice is this tendency for healthcare professionals. So this includes, physician assistants, dentists, nurses, other therapists. There is this tendency to think that you can treat yourself. You have the training, the education, the background, the expertise for other people to come to you for this guidance. So we have this tendency to think, well, I can just guide myself. I can get myself out of this. And a lot of the times trying to do that on your own isn't very effective. So that's why it's so important to reach out to others for support. Know that other people are out there that care about you and they want to help you through your emotional and mental challenges and struggles. So hanging out with friends and family outside of the world of medicine is also important. Otherwise, you're going to find yourself constantly with the same group of people and commiserating about the stress together. Negativity, stress, all that kind of stuff is contagious. So I think it's really important to remind you to also have a life outside of medicine, in order to find satisfaction and meaning in so many different other areas of your life. So why am I here? Why am I talking about all this stuff? Why is BetterHelp partnering with AMSA to provide this information and some tips? BetterHelp is a platform, an online counseling platform, right? And what we can do is provide you with a discreet way to connect with a counselor. You don't have to drive to an office or find yourself trying to schedule a time to get here in between classes or do that in between exams. It's all just discrete from your device, and there's convenient scheduling for busy people, which I know that all of you are. We connect you with a professional licensed therapist that can provide mental health as well as career counseling. So career counseling is one of the areas of specialty that we have for counselors to mark off. So if that's something that you want to look into too, you can probably find that here as well. Through the platform, your counselor can also use interactive worksheets and provide concrete strategies to help manage some of the stress. And finally, there is no cost for you to find out if it's right for you or not. This is a very different kind of way to connect with someone. So maybe it's not the best format for everybody. Not everybody likes to connect through text, video, and phone, but we want to give you an opportunity to see if it's going to be something helpful for you.
So if this sounds like something that you would like to try out, as part of being an AMSA member, we offer 28 days of free therapy. So this offers you unlimited communication with your therapist. You can either text, chat, video conference them, and they will personally match you with a licensed professional therapist. So after those 28 days, if you decide you'd like to continue on, we offer a further discount at $45 per week, which is billed monthly. And if you decide that it's not working for you after 28 days, it's still no cost to you. So this is a really great offer that is out there for you as part of being an AMSA member. And we're really excited to have this partnership with BetterHelp. So if you are interested, please follow the link on the screen, and they can get you started, signed up today, and match you with a professional. So I want to thank everyone that joined us to watch this webinar today, and thank you, Hasu, from BetterHelp for providing us with some techniques and management and helping us increase awareness about physician burnout.
Thanks so much for having me.